So I have brought to you landmark guided peripheral nerve blocks. So let's start. These are some of my credentials. Now, the highlights of my session will be, first of all, I will be describing the ergonomics. Then the last, that is local anesthetic, systemic toxicity, and risk management. And in upper limb nerve blocks, I will describe axillary brachial plexus block approach. And in lower limb nerve blocks, I will describe femoral nerve block. And the remaining blocks will be described and elaborated by Dr. Maimouna Sheikh in her second presentation. So about the ergonomics, you don't need any heavy equipment or advanced gadgets when you are going for a landmark technique. So all you need is just needle, syringes, simple, pressure lines, sometime yes, sometime no, and the drugs. Now about the ergonomics, the needle and syringes, the choice of syringes, there are lure lock syringes and then lock slips, but we usually prefer the lure lock syringes. And there are needles that come in different sizes, and these needles are also available separately in different sizes. You can choose the size of the needle as per condition of your own patient. Now, about the choice of syringes, there are different kinds of syringes like 10 cc and 20 cc. So we prefer 10 cc syringes over 20 cc syringes just because it has moderate pressure and flow as compared to the 20 cc syringe. And it comes with a needle that is of 21 gauge size with 1.25 to 1.5 inch needle length. So about the drugs, these drugs, xylocaine, ropivacaine, and bupivacaine, these drugs are available right now in Pakistan for local anesthetics. These all are available in 10 ml preparations. Xylocaine comes in 2% in 10 ml. Bupivacaine comes in 0.5% strength in 10 ml. And the ropivacaine also comes in 0.5% in 10 ml strength, 10 ml preparation. Now, a little recall of the local anesthesia dosing. So about the drugs over here, we have lidocaine, we have bupivacaine, and ropivacaine. So lidocaine is dose per kg body weight is 4 mg per kg. I hope most of you people already know that. Then bupivacaine the dose of bupivacaine is 2 mg per kg, and for ropivacaine it's 3 mg per kg. Now for a 50 kg person, xylocaine or 200 milligram of xylocaine is enough, and 100 milligram of bupivacaine and 150 milligram of ropivacaine is enough. For 75 kg person, you can safely go for 300 milligrams of xylocaine, 150 milligram of bupivacaine, and 225 milligram of ropivacaine. Now, if you look closely on the mLs, so for a 75 kg person, a pure 2% of 15 ml will be safe, and 30 mLs of 0.5% and 45 mLs of 0.5% of ropivacaine can be safely given to a 75 kg patient. Now the maximum dose in 24 hours. So how much is too much? Now about the xylocaine, 300 milligrams, do not exceed the limit. 175 milligram for bupivacaine and 400 milligram for ropivacaine. Duration of action, as you can appreciate, 30 minutes for xylocaine, lidocaine, and with epinephrine, it extends up to 90 minutes. Bupivacaine and ropivacaine, usually they have almost similar duration of action, and that is 4 to 6 hours to 8 hours. Now, some of the warnings are there for xylocaine. Do not repeat xylocaine within 2 hours, and for bupivacaine, just keep in mind that it's quite cardiotoxic, so you have to be very careful. Now, how to decode? Now, this is my favorite slide. Now, doses, volumes, and concentrations of the local anesthetics are very confusing usually. Now, about the dose, like we calculate the dose in milligrams, right? Yes, and volume, we prepare the drugs in the mLs, and then we express the concentration in percentages. Now, that's quite confusing. Let me make it a bit simpler for you. how to decode quickly percentage concentration into milligram per ml. Now, sometimes this is very confusing that you just wonder sometimes that what is meant by 2%? How many mgs, how many milligrams are there in 1 ml of xylocaine? So let me explain it to you. I will tell you a life hack and to make it easier. So whenever you are in doubt, just multiply the figure of 10 with a percentage. Let me show you. 2%. Now, you may think that how many milligrams are there in a 2% xylocaine solution. Now, let me make it easier. Just multiply it with 10. So it will give you 20. So that means in each ml, there are 20 milligrams of xylocaine. Let's do it again. 0.5%. 0.5% means just multiply it with 10. It's a tip, like it's a hack. Okay, multiply it with 10, so it will give you 5. So it means that in each ml there are 5 milligrams of bupivacaine. Okay, I think it's clear. So in the 10 ml ampule of bupivacaine there will be 50 milligrams, and in 10 ml ampule of xylocaine there will be 200 milligrams. Okay, now that's quite an interesting slide. I have made this slide for you. You have to prepare a 20 ml of 20 ml volume of xylocaine with 1% concentration, right? So how you will do it? Now you have to convert 2% xylocaine into 1% solution. That is the half of the strength. Now when you need half of the strength, you dilute it twice the volume. I will repeat. When you need half of the strength, you will dilute it in twice the volume. How you will do it? Let me show you. Now, 10 ml, as we know that xylocaine comes usually in 10 ml ampule. Just dilute it in the twice the volume, that is diluted in 10 mls. Now it will become 20 mls volume. Now the volume is twice, but the strength, the concentration comes to half. So simple. Now we can do another example here. You have to prepare 40 ml volume with 0.125% bupivacaine. Now, how you will do it? Now, as we know that bupivacaine comes in 0.5% preparation in 10 ml, you have to convert into 0.125, like 1/4 of the strength. Now, listen carefully. When you need 1/4 of the strength, dilute it 4 times. When you need 1/4 of the strength, just dilute it 4 times. How? It comes in 10 ml. Just add 30 ml, make a 40 ml solution. Now the volume is 4 times the original volume, but the concentration reduces to 1/4. The dose will remain the same. So that's just a little hack, how you just prepare the volumes and keeping the concentrations in the required range. And with the safe dosage, as you can see here, the dose will remain the same. The 50 milligram is safe. If you're injecting 40 ml to a patient, you're just giving 50 milligrams and that's nothing. So it's a safe. So it will be safe. Now about the anesthetic doses, some people ask if you want to conduct a surgery under local anesthetic, under regional anesthesia, how will you, so what concentration will be required? So about that, if we are talking about bupivacaine, let's say, for example, then for the anesthetic doses, we can go for 0.25 to 0.5% concentrations, and for analgesic doses, we can go for 0.125 to 0.0675. That is 1/8% of the 1/8 of the concentration. Okay, some important tips. Facial plane blocks are volume dependent. And adequate analgesia can be achieved even with a lower concentration. So always calculate the safe dose limits before preparing for the block solutions. By taking lower concentrations, you will be able to use larger volumes, as I have shown you the examples here. Always take consent, always have an IV line of your patient, and always have full understanding of anatomy under the, just anatomy under the surface anatomy. Now, about something very important. Last is the local anesthetic systemic toxicity. I will not go too much into the details, but I want to show you that there are neurological symptoms when there's local anesthetic toxicity and cardiovascular signs and symptoms. So what you have to do, you have to follow the 3 pillars of last treatment. That is seizures management, the neurological management, cardiovascular management. You have to immediately start ACLS, advanced cardiac life support, and the most importantly, you should have this drug. As you can see, this intralipid emulsion picture over here. You just have to immediately start administering 20% lipid emulsion. Now, this is algorithm given by Sairah. There are different guidelines. I have shared some QR codes. You can scan them in the next slide, and you will be able to read all the guidelines available on internet to manage local anesthesia toxicity. I'm just sharing the simplest form of the local anesthesia management algorithm given by Sairah. So after initial resuscitation, just focus here about the lipid emulsion therapy. For less than 70 kg, and more than 70 kg. Now, less than 70 kg, start with the 1.5 ml per kg bolus over 2 to 3 minutes. That will be followed by 0.25 ml per kg per minute infusion. Now, for more than 70 kg person or patient, give bolus of 100 ml over 2 to 3 minutes. That will be followed by 200 to 250 ml of infusion over 15 to 20 minutes. So these are the QR codes. I would like everyone to take a screenshot of it so that I can move to my next slide. Just take a screenshot. You can scan these codes later. These are Medscape guidelines. ASTRA is the American Society of Regional Anesthesia Society guidelines, and then Sairah guidelines for the local anesthesia toxicity. That are very important to be kept along. So just take a screenshot. So I'm moving to the next slide. Now, our main topic, landmark guided nerve block.